Um, I really appreciate the opportunity to be here. Connecticut, of course, has a proud history of working for Medicare for All and universal health care. I remember when I was back east in the 90s, we definitely saw a vibrant coalition in Connecticut. And so I really appreciate the opportunity to be here and talk about what we're doing in California and some of the federal stuff. And as Stefan mentioned, I am president of Healthy California Now, and this is a statewide single payer coalition that has been around for many years in different iterations. We had a coalition during the really starting in the mid 90s, during the 2000s, and then this current iteration really started in 2017, where we had a single payer bill make it through the state Senate, and I'll talk a little bit about that. This is our most recent newsletter. Like you all, we have different committees, ways for people to participate, including an organizing committee, a strategy committee, communications. We're governed by a board that has representation based on constituency. And we have also affiliates, and we meet monthly as both a board and as affiliates. And the current newsletter reflects our priorities, which is really to get Governor Newsom, who ran on single payer, to keep that promise. We had action in June 15th, where we brought 300 folks to Sacramento to present tens of thousands of petitions to the governor, urging him to pursue it. We have been focused on, our affiliates have been focused on beating back the recall, because we certainly don't want a governor who ran on single payer to be defeated. And that's happening today. And all the signs are that it looks promising. About over 42% of the eligible voters have already turned in their ballots, and we just got a few hours left. Everyone's projecting a win and a defeat of the recall, a win for Governor Newsom. There's also a commission that the governor set up, we can talk a little bit more in depth about, which is considering paths to universal health care. They call it unified financing. We call it single payer. And there's also very significantly legislation, AB 1400, CalCare, which has been introduced by the California Nurses Association, National Nurses United. So as always, we've got a full plate, and that's in addition, of course, to the federal work, where we're part of the campaigns that you all are part of, getting co-sponsors on HR 1976. And we'll talk a little bit about Medicare expansion toward the end. So these are a list of affiliates. You can see it's a nonpartisan coalition: consumer, labor, health, disability, LGBTQ, business, and political organizations. We have sponsors, two of the state's leading labor unions, the National Union of Healthcare Workers, which I represent, and also the Machinists Union sponsor the coalition. And labor outreach is a key part of our current work. Talk a little bit about that. And we have the historic organizations that have been part of single payer. You'll recognize them nationally, like Physicians for National Health Program. And then, of course, the Healthcare for All Coalition in California, who both statewide and its affiliates are a member. Probably like other places around the country, we've seen a real upsurge in activism among younger folks, primarily through the Democratic Socialists of America. I've been a member for decades, but really the energy is coming from folks in their 20s, and they have done a lot of work on this campaign and for AB 1400. Some of the most active groups in the state are concentrated in Los Angeles, Healthcare for All LA, DSA LA, but also the really base of the movement has often been in the Bay Area, and it continues to be very prominent in there. And you can see that we do have a number of unions who are affiliates, including labor councils in some counties. We've got unions from the entertainment industry, from the hospitality industry. Unite Here is a very prominent, active member of the coalition. You've got the Sacramento Central Labor Council, the Alameda County Central Labor Council, San Francisco Building Trades. And so there is, and some SEIU locals, including 10 to 1, which is one of the largest public sector unions in the state, as well as AFSCME workers at the University of California. and other workers in the public and private sector. So we've got a good range of affiliates, including, of course, California Nurses Association, which really had funded and driven the coalition in its 2017-2018 period. So just briefly, a history of single-payer legislation. The bills SB 921 and SB 840 were really quite prominent in the 2000s and the aughts. And in fact, they made it to the governor's desk. But guess what? The Republican governor, you may have heard of him, Arnold Schwarzenegger, vetoed it. And when we talk about the 2000 recall, where Governor Schwarzenegger was elected in a similar procedure as going on today, one of the consequences was we had a governor that was not open to single payer, and he vetoed it twice. And as you can see, it enjoyed quite significant support from Democrats in the legislature. A little cynical about that, perhaps. Our view has been that as long as there's a Republican governor to veto it, Democrats are on board. Things get a little iffy when that changes, and that's what happened in 2017 and 2018, when the legislature enjoyed a significant Democratic majority, and there was, of course, a Democratic governor in Jerry Brown. We were able to pass it out of the Senate. This was the top priority for the California Nurses Association, but it was held in the Assembly, ostensibly because it didn't include specific financing provisions. But as you can see from the prior bills, they didn't either, and yet they made it all the way to the governor. But the truth is, Governor Brown didn't support it, and therefore it got bottled up before it could reach his desk. In response, they set up a select committee on universal coverage and healthcare delivery systems. It gave a report that was supposed to be the alternative to SB 562. Guess what? Nothing happened. We found ourselves now in the period of 2021, where the California Nurses Association have reintroduced a bill, AB 1400, very significant piece of legislation, really building upon HR 1976, the Jayapal Medicare for All bill. It was not in the California legislature. It's a 2-year process. There are deadlines for the first year. It did not get referred to a policy committee in time to move forward in the first year of the legislative session. So it now became a 2-year bill and must pass the Assembly by the end of January 2022. So it will become live again in January, and a health committee hearing is expected. There's an ambitious campaign that CNANNU is recruiting volunteers for to build up a kind of what we know from past Bernie campaigns and other digital organizing campaigns as a distributed organizing campaign through text banks, phone banks, and also in person, hopefully, legislative meetings to put pressure on 30 members of the Assembly in key districts to get on the bill. Right now it has, I think, 11 co-sponsors in the Assembly. It represents a significant move forward for guaranteed healthcare, guarantees healthcare for all residents as a human right, establishes a single standard of quality care as a right, and has provisions, broader provisions for guaranteeing equity and culturally competent care. It does have differences with past single-payer bills in that it precludes integrated delivery systems, which not only include Kaiser Permanente, which has about 8 million Californians that it covers, but also other integrated delivery systems that exist in the state through community clinic consortiums and so forth. That's been an issue, a policy issue, where it also precludes membership-based systems like Kaiser and per capita payments. So some of these issues have been discussed at the Healthy California for All Commission. Healthy California now has focused on the commission, which was established by the governor and by the legislature. It's going to report in a similar time frame that AB 1400 is going to be considered in January, possibly February of 2022. And so what we're seeing through the Healthy California for All Commission, which includes appointees, includes a representative from the CNA and other advocates for single payer, as well as organizations that are more skeptical and some policy folks who are frankly opposed. But there have been presentations from Dr. Shao, who you may know from Vermont, who has designed healthcare systems around the world, was active in the Vermont struggle in 2011 and 2014. He put forward an analysis along with other consultants that showed that if we don't do anything in California, we're going to spend $800 billion a year on healthcare by 2031. So it's quite unsustainable, the present system. And so the commission is taking a very serious look. And most recently, its chair said that he hopes the report includes and expects the report to include a path on how to get to single payer. But there still is many obstacles to consider, including resolving this debate about payment methodologies, integrated healthcare delivery systems. There's going to be a series of meetings coming up in September and October that will, I think, really mark how the direction of that commission. We focused on the governor because, as you can see from the past, Governor Schwarzenegger, Governor Brown's failure to support single payer in the last 17 or so years has been fatal to it. And Governor Newsom ran on single payer, says he remains committed to it, has reached out to the Biden administration to seek their support. So we're urging him to pursue what we know as the federal waiver. And that waiver enables states to integrate federal monies into a single payer system. And in fact, it's not possible to design a state financing plan until you know when and how much the feds are going to contribute. We've adopted the strategy because it focuses on a single decision maker with power, a strategy that has credibility with opinion leaders, and he's the one ultimately that will carry the recommendations from that Healthy California for All Commission forward. Here's a former member of the Assembly who talks about this strategy. This is Los Angeles school board member Jackie Goldberg, who has a long history going back to the radical 60s in Los Angeles. And she makes it very clear. We need the governor to seek a waiver. It's very strategic. It's the administrations in Sacramento change and go back and forth. The bill comes and goes, authors come and go. But once you have a waiver, once you know what the federal government is going to do, then you can build a system around it and have a real benchmark and momentum going forward. And the fact is, without governor leadership, it simply won't happen. And she makes a very strong case for that. Some have insisted that we have to pass a bill first, and there are federal guidelines and regulations that do allow a governor to either through executive order or using existing legislation to seek that waiver. Regardless, you can enter into informal negotiations with the federal government, lay out a plan, and use that the basis for financing and state legislation. So our objective is really ultimately for Gavin Newsom to lead the way. And he has supported it. Here he is in 2018. The executive needs to lead it. Obamacare wouldn't have happened if it was just exclusively a legislative fiat. We saw that in Massachusetts, unfortunately, with Governor Romney. And you have to have, a change from what the past has been. And he recognized that when he campaigned for office. He has not fulfilled that promise, and we're demanding that he do so. Governor Shumlin, who you may remember was governor of Vermont during the time they sought to do single payer, has said the same thing. The legislature can't lead. They have to have a salesperson, and he thinks that Gavin Newsom can be that salesperson. First, he's got to survive the recall, so we'll see. But he has managed to navigate through some pretty treacherous waters, obviously, during the pandemic. And finally, the Speaker of the Assembly, Anthony Rendon, shows strong support for Healthy California Now's effort to pass and enact single-payer healthcare and seeking federal approval as the foundation for a state-sponsored plan as a crucial step. So you can see how there is an alliance. The AB 1400 effort moves the legislature, puts pressure on the governor to act. Getting the governor to lead sets up the legislature to have no excuses to act. And so we see these strategies as complementary and very effective in combination. And you can see from some key decision makers that we're in a unique position in California, that this is not as far away as it is at the federal level. You've got a president at the federal level who has said he's opposed to Medicare for all. Unfortunately, that makes a huge difference. And you can see that as it plays out in the Medicare expansion fight. I don't think any of us need to imagine the difference between what a President Sanders or President Warren would be doing right now on healthcare versus what is going on in Congress and what President Biden ran on expanding Medicare age to 60. He's not expending a dime of political capital to make it happen. Senator Sanders is, and others are, trying to expand Medicare to include dental benefits, but there's a fight. And they're basically being told, hey, you got $700 million for healthcare, $700 billion for healthcare. Figure out how you're going to spend it. And if it means that we're going to spend it on subsidies to commercial insurance through the ACA or expanding Medicaid through the ACA, well, then those are the priorities of Speaker Pelosi and the House leadership. So Medicare expansion gets what's left over, despite the fact that the bulk of that money comes from savings from prescription drug price negotiations under Medicare. So essentially, they're robbing Peter to pay Paul. They're taking money that is savings from Medicare and spending it to subsidize the profits of private insurance companies. It's unacceptable. That's a fight worth having. And the initial proposal in the House for dental benefits with 90% out-of-pocket copays effective 2028 is, quite frankly, ludicrous. And so there's a real fight to get a meaningful expansion of dental benefits. And even though the president, as I said, ran on lowering the age to 60, that doesn't seem to be currently part of the House strategy. We are, like you all are, fighting for the state-based universal health care. We believe maybe there's an opportunity to get some of those provisions in through Congress without the full-blown bill, possibly through reconciliation. We're also pushing, we've had tremendous support from the Democratic Party in California for HR 1976. Like you all, there have been resolutions passed at the local level for Medicare for all, both for the federal bill and for the state bill and for the governor leadership. So our resolution campaign often combines all three of them. And then we're, of course, working for the state-based Universal Health Care Act itself. So we've got a real fight on our hands, but we've got some unique opportunities. We've got the opportunity to show that Medicare really can be an expansive and improved public program. We've got real political leadership in California, a unique opportunity here that we haven't had in the past to actually show us a model for the country to really, as Sivan said, to take that template of the state-based universal healthcare and use that as a model. Governor Shumlin said that if California were really serious and on directly about to implement single payer, the Democrats in Congress would be pretty hard pressed not to follow and would probably feel compelled to do so. So we always see this as a political strategy. We've talked, for years about what the moral righteous thing to do is. We've talked about what the policy case is unassailable, overwhelmingly in favor of single payer. And we keep saying to the Democrats, well, you just got to do the right thing. And they haven't. They're beholden to the insurance industry, to the pharmaceutical companies. We've got to show that it is in their political interest to do Medicare for all, regardless of whether they want to or not. And when the biggest, most democratic union in the state does it, that shows it can be done and it should be done, and it creates a totally different political dynamic. It's time to not just exhort and demand, but actually prove that it's politically possible and do it, and it's in the political interest of Democrats. And if they don't do it, then it's the time to move them out of office and make this truly a litmus test for how to guarantee healthcare as a human right. So thank you for this opportunity to present.